Sometimes you just gotta believe.
Hello guys, welcome back to my channel. My name is Dele. I am a Nigerian YouTuber based in England. Welcome to my channel. First thing first, like I always say, thank you to all those that watch my videos, like my videos, share my videos. Thank you. And if it's your first time seeing this a beautiful face, don't forget to like, share, subscribe, all of those good stuff. So let's go straight into today's video. I have got a special guest on my channel. I've got the wonderful Ifeoluwa Iyaniwura on my channel. Ife is a nurse like me. I met Ife few months back on Clubhouse. Yes, on Clubhouse. Do not underestimate the power of social media. So yes, I'll be interviewing Ife. Ife has got over 5 years experience of working in ICU. I wonder just because this is really just to help someone out that is trying to decide specialty to choose as a newly qualified nurse or someone that's trying to change their specialty from a particular specialty to A&E or to ICU. This is not to persuade you to leave your specialty to work in A&E or ICU. Just a video that I feel like someone out there might be in need of. So she'll be sharing her experience with us today on my channel. I've got over 7 years experience of working in A&E. Well, 6 years experience because I've left A&E now. And I will be comparing some of our experiences, skills, and knowledge one another. Sit back and enjoy this video. Don't forget to like, share, subscribe, all of those good stuff. Now we're going to welcome Ifeoluwa to join us today on my channel. Welcome, Ife. Thank you for accepting my invite to come onto my channel to share your wealth of knowledge with us as an ICU nurse. Yay! Hiya guys! Hi! We've got the one and only Ifeoluwa Iyaniwura on my channel. Gosh, it is a privilege to have Ifeoluwa on my channel. So I met Ifeoluwa on Clubhouse. This was when on lockdown, I think the second lockdown was sometime last year.
No, it was actually, yes, last year.
The second lockdown was last year on Clubhouse. We used to meet in different rooms. So I connected, and we've been friends ever since. Like we've never met face to face. Eventually, we would, but at least it's been a long time. We've been planning this collaboration for my channel. We need to feel one from your channel also because Ife is also a YouTuber. So Ife, I am privileged and honored to have you on my channel, Ife. Welcome to iDiva channel. Wow, Ife, like she is an amazing nurse, a content creator, especially on Twitter. Like she's got a huge following on Twitter. She has a community of nurses that she mentors, especially newly arrived nurse into the UK from many Nigeria and other African countries or even Asian countries. She can take you within her wings and help you to navigate what it's like to settle in England or United Kingdom, to be precise, as a nurse, an international trained nurse in the UK. So I'll leave the link for our YouTube page, Twitter, Instagram, Facebook, and you can contact her if you have anyone or if you are thinking of migrating to the UK as a qualified nurse. So the first question is, who is Ifeoluwa?
My name is Ifeoluwa, and I think Dele has pretty much said everything. First and foremost, I'm honored. I think I'm honored more to be here, Dele. I mean, you inspire me in so many ways.
Oh, thank
your
you.
tenacity, your attitude to work, you're one of those few Black nurses that I know who genuinely loves what they do. It keeps through you.
Thank you.
And that honestly, and also your content creation. I mean, you're so consistent. You're always pushing out content, and I'm like,
thank you.
some of us are just we're just playing.
Thank you so much. Thank you.
So you honestly you inspire me so much. And you're my girl. You know that you're my girl in this thing. So thanks so much for having me. I think this was way long overdue by the way.
Yes.
I hope that this is going to be the start of us collaborating,
working together. Yes. Amen.
So I think you've described me in a nutshell. I'm a mom as well, and I work as a nurse. Now I work as a clinical research associate within clinical research. A lot of people ask me, what does that mean?
Yes, please.
To sum it up, you're pretty much just a project manager in clinical research, in
Nice.
clinical research projects, if that makes any sense. It means that I am the bridge that connects the sponsors with the site. So the sponsors are the ones who are funding the clinical research that we do within, either private organizations or the NHS or any of these healthcare organizations. Pretty much in layman's term, for any medication that needs to be used, let's use COVID vaccine for an example. Before they could say that COVID vaccine is ready to be used for the general public, it goes through a trial process. And where I come in within that trial process is I make sure that the project is well done. So I'm the one who is overseeing. I'm one of the team who is overseeing that everybody within the team on the site front is doing what they're supposed to do. So I'm pretty much managing them whilst I'm reporting back to the sponsors to say this and this and these are the issues. How do we resolve it? So pretty much just a project manager within clinical research. And I used to, is it used to or still is, because I
You're
don't like
still
to
ICU
consider
for life.
myself an ICU nurse because I still do odd bank shifts as an ICU nurse every now and then, but just because nursing is a core part of me. I'm a YouTuber as well. I talk a lot about nursing and midwifery, migration, a little bit about lifestyle. I tend to once in a while just talk about acts and, I mean, we've lived in the UK for a minute and we've also made some mistakes as well. I'm sure
Mm,
you know daily, but
we all do. We
yeah,
all
I
have
think
done. Yes. So
exactly. I think the most important thing and the reason why I created my nursing community is to ensure that these guys don't have to go through some of the things we went through because we didn't know. Right. So I'm meeting with a few of them on Monday, Bank Holiday Monday, for the very first time, and I'm
oh,
really excited to
well
meet
done.
them.
Yes.
So so yes. So
Thank
I
you
think
so much.
that's me in a nutshell, pretty
Thank
much.
you. Thank you. Thank you for the amazing things you're doing to help the newly arrived nurse from Africa. Or to be honest, when we first moved there, although I moved there as a teenager, I had my mom and my siblings with me. But I feel like there's some information that if we had people like you to have helped us to navigate our way settling in the UK, I think we'll have made better choices. But what I say to people is it's never too late. Even if you're in your 50s, your 60s, as long as you've realized that you've made that mistake, okay, what steps can you then take to make sure that you go back onto the right path to get to where you need to get to? So yes, when did
Thank
you
you so
start your
much.
career in nursing?
That's a very fantastic question. I've, I mean, right from when I was like in secondary school, I've always wanted to be a nurse. But it didn't happen. I mean, I don't know. You grew up in Nigeria a little bit. You know how the education system is very interesting to navigate sometimes. So anyway, I couldn't do it, so I did something else. And but the opportunity arose when I moved to the UK some years back, and but because I knew what I wanted to do, right? It was easy for me to start, right? It was easy for me to, how when people migrate and they're still scratching their heads very that like, do I do this,
What
do I
do
do
yeah,
that?
exactly.
Then people
Yes.
do 1 or 2 degrees before they finally decide what that was not
Yes.
my case. I knew exactly where I was going. So I just started researching how do I get into nursing? What do I do? What credits do I need? Do you understand? And I started earlier on. I remembered, I got pregnant almost immediately when I got into the country and I had my daughter. During my maternity leave, I was researching, I knew that, okay, I could do access to nursing. I enrolled into college when my daughter was just about 3 months. So when she was about 3 months old, that was in 2012, I got into college. I did the 1 year access to nursing. I couldn't start uni immediately because you have to have lived in the UK for 3 years in order for you to be eligible for the sponsorship at the time. So I had to wait. I had to defer my admission into to January 2014. And then I graduated in 2017, and I started out in ICU in that 2017 September. Nursing is hard. In fact, I think nurses who did nursing in school should be saying, because we tend to just think it's a walk in the park. It's not. It's hard. It takes your blood and sweat and
Exactly.
water.
Especially you have family commitment also.
Exactly.
Very
I knew that I wanted to do research. Right.
good.
And I knew that the way to get into research quickly was for me, maybe ICU experience would help.
Okay.
So when I was in ICU, I was also volunteering in the research department. And this is what I tell people who want to do specialist roles, that one of the very quick ways of getting into there is put your best foot forward. If it is just 4 hours a week that you can take, you can spend in that department, they will know you. When a role comes up, you are the first person that is going to know.
Exactly.
Started me out on the path, on the band 5, what do they call it now? Step 1 competencies for ICU. And that was how I started in 2017. And I can't believe it's been 5 years that I've been a qualified nurse in the UK.
Wow.
It goes
so quick. Yes, it does. It does actually. Thank you so much for sharing that with us. And also, you mentioned something earlier that I wanted to speak on. You said about if you want to move to another specialty, it's a good opportunity for you to meet up with the specialist nurses, do a bit of experience with them, and also even that will make you make a decision if that's what you really want to do. So apart from even the fact that they'll get to know you and you get to understand what they do, you'll be able to tell yourself
hasty decisions as to changing careers and changing pathways. It's always best to go into the department, have a feel, have an experience. The truth is, they won't turn you down. All you need to do is be persistent, be consistent, that you want to do this and you want to see what they do for a day. It's just for a few hours in a day. Just overshadow them just to see what they do. So yeah, I think that's one of the ways to do these things, pretty much.
I agree. For me, as an A&E nurse, or as they like to call us sometimes ED, emergency department nurse. For me, I didn't really decide. I didn't want to work in A&E. So when I was in April of the year, I was qualifying. They had like an interview, like what's it called now? Recruitment day at this trust very close to where I live. I didn't do my training at that trust. I did my training at another trust. But because this trust was close to where I live, so I went for the opening day and we did the interview, the maths, the English test, and they called me back later and said, "Oh, I have been chosen to start in September if I've passed all my placement and my exams in September." But it's going to be in A&E because the interviews we did was just a general interview, and then they would decide what specialty you will be selected to work for. So when they called me, they said to me A&E. I said, "Oh, A&E," because I know a lot of trusts don't like recruiting newly qualified nurses in A&E. Because obviously I can understand why it is very challenging for a newly qualified. Because I remember the second day I was already looking for another job that this A&E is not for me.
Cannot be.
Or like it was so challenging. So when they decided that okay, I've been chosen, I'm going to work in A&E, I said, "Oh, okay, I'll give it a go." And yeah, and that's how I started my career in A&E. So really, it wasn't really my plan to start in A&E because I never had an A&E placement like you did. I had like an AMU placement, step down from A&E placement. So I had a bit of an idea of what it's like to work in A&E, but it wasn't A&E. So I never really got the opportunity to do placement in A&E. So when I got the job and I started in September, like I said, I felt like this is not for me. We are going to resign.
I always say that A&ED nurses, you have to actually like it. It has to be your thing for you to be an ED nurse because
oh my god, and it's something you really want to do. Like there is a lot, even though it's very challenging, there is a lot of skills and knowledge that you acquire as an A&E nurse. Like I cannot underestimate that. Like wow. And that's why I feel like 7 years on, I've qualified 7 years ago, and I've never worked in the ward, never worked in ICU, never worked anywhere else except A&E. Although I left A&E last year because I know one of the skills that I currently still use as a nurse practitioner is what I developed that from my A&E experience. So we'll talk about that later. But yeah, so it is very challenging for newly qualified, but it is doable if the trust is willing to accept you to work in A&E as a newly qualified nurse, and you feel like it's one thing that you want to do. I would advise you to give it a go and see how it goes. So yeah, that's how I started my journey in Okay, so
A&E.
the next question is transferable skills. So give us some transferable skills that you've been able to transfer from your knowledge as an ICU nurse and now as you work as a clinical research nurse, or even to other wards that maybe like in A&E, when you worked, you said in some placement there, some bank shift there, and also everywhere else that you feel like as an ICU nurse that you can transfer, you can take that skills and you can still use it in other work settings.
So one of the major transferable skills that I use in my current job, which has been really useful for me, is the fact that I have clinical experience. So a lot of the people that I work with don't have clinical experience, right? So so I work with data a lot, and I can spot a deranged data from a mile afar. I can tell, BM, this is wrong, um, this patient is tachycardic, what did you do? Especially when you're recording, we call something in what I do, adverse events and serious adverse events. So I learned in ICU, was reading ECGs, I could tell a normal ECG from an abnormal ECG, so, and also when I still bank, because I need to keep my registration. I want to keep my registration. So I still bank. And one of the things that a lot of people point out to me every time when I'm working, and they like me, is that I'm very thorough.
Yes.
We learn from ICU is most ICU nurses have a good knowledge of sepsis. I mean, we did a whole course on sepsis, and you can, if I'm sleeping, I can tell when a patient is going to be septic. That the Bible says that a man that is diligent in his ways, right, will stand before kings and not near them. Honestly, and I stand on that word every time. And that word has really worked for me in my journey, as both as a nurse and in what I do currently. So I'm going to show up, and I'm going to show up good. So that's usually my aura, at work. And it's always worked for me. I'm never stressed.
If you work in A&E, like I said earlier, you'll be able to acquire a lot of skills and knowledge. But I'm just going to touch on what I feel I can just touch on right now, just because what I do currently. I currently work as a nurse practitioner, and one of the skills that you acquire as an A&E nurse is triage. So you learn how to triage patients. So when patient comes through the door, you are the first point of contact with those patients. The one that's going to assess the patient and then prioritize the patient based on the needs of the patient. And that skills I am still currently using it as a nurse practitioner, because your initial assessment, you are triaging, let's say you're assessing the patient to know what treatment plan is best for that patient. So that's one of the reasons skills I've been able to acquire as A&E nurse. And also as A&E nurses, we work in pediatric department sometimes. And for me now, I am an experienced pediatric nurse, even though I'm not a trained pediatric nurse. So they call us experienced pediatric because obviously we care for a lot of pediatric patients. Even now, as a nurse practitioner, I also assess babies, infants, toddlers, school teenagers, school age children, because I've been able to acquire. Although I did special training as a nurse practitioner to be able to assess pediatric patients, but I also acquired that skills from also as an A&E nurse. And then just working well under pressure, because even that pressure, safely caring for your patients, even with all that's going on around you, I think is a special skill for anyone to acquire. So yes, even though where I work now is a bit subtle, it's not as obviously challenging, but it obviously has its own challenges, but it's a skill that anyone in A&E will acquire.
And I think you